Hey, good evening, everyone, and welcome. Thank you so much for joining us. This is the Healthy Start Parent Overview that you're just about to engage with. My name is Cathy Turner, and I've been working with Healthy Start for the last couple of years, and I work in the area of communications. Communications, probably the most purposeful job I've ever had with the biggest story I've ever been a part of. I think we all like to be a part of something bigger than us. Well, this is certainly that. And it's going to be big in your life. If you have children with any of the issues that, for instance, my grandkids had, that's how I became involved with and so fascinated by everything that Healthy Start can do for a child. It's an Ortho-Tain company, and it's been around for 50 years. We're going to introduce you to what it could mean for your children and their future with Dr. Ralph Dolfi in just a moment. But first, let me tell you about the doctor who's behind all of this and has been at it for over 50 years. We call him the world changer because, quite frankly, he truly is just that. He is a board-certified orthodontist. This is Dr. Earle Bergersen DDS, MSD, ABO, and he founded Ortho-Tain back in 1967. So he has, as I say, been at it for over 50 years now. He is an inventor, and he has developed what we call a system, a treatment system, Healthy Start, under Ortho-Tain. For 25 years, he was a professor at Northwestern Dental School. Now, the dental school is no longer there, but of course, Northwestern University is. And just in the next couple of weeks, we're all going to be heading in that direction to honor Dr. Bergersen as he delivers a lecture for continuing education for the doctors and dentists and orthodontists that so many of the parents that are watching tonight will eventually go through their door to get just this treatment for their child. He is going to be doing that lecture, and I'm sure that with 3.5 million children that he's treated around the world over the last 50 years in 37 countries, he will have a lot of case studies that he will be able to share with doctors and show them routinely how they're able to correct for and address some of the growth and development problems that develop along the way. He's developed along the way over 500 U.S. and international patents. The patent attorney, incidentally, told us that that makes him the most prolific patent developer since Thomas Edison. So that's pretty incredible. He has delivered over 500 seminars. He has been 80 times published, and he has 80 monographs. Well, if you haven't started taking notes yet, maybe I should encourage you right about now that all of these fascinating things that you're seeing and learning about, maybe questions that you have, hopefully you've been sitting back with a cup of tea, and you can ask those questions right online. There's a little Q&A area on the bottom of your screen. That's fine. We'll address some of those questions when we get to the end if they haven't already been discussed, because logically speaking, we'll probably cover a lot of things that occur to you. But let me just tell you that as far as those appliances go, what you're going to learn about is completely safe. It's non-invasive. Sometimes we even refer to it as a pillow for the teeth. It's FDA approved, Health Canada certified. It's the equivalent of a Class 2 medical device. And that means basically that it could be implanted in the body. So from here, I'll tell you that, again, there are no BPAs, no silicone, no latex. The appliances and the cases themselves are all antimicrobial in their material, ISO certified. And of course, I do believe this is the week in the United States that we like to talk about American made. And this is an American doctor and an American-made product line. So now let me tell you about the wonderful doctor that we have with us this evening. And when I say that, you're just going to have to take it on my word until you hear him speak. And then you will completely share that opinion. And hopefully, because we're live on Facebook, you will share this presentation because it's being recorded. We know that so many children are affected that you'll probably have a lot of moms and dads who will love to learn from Dr. Dolfi. So he, in 1979, was a graduate of the University of Pittsburgh School of Dental Medicine. And Dr. Dolfi started out in North Carolina. And he started out, and I love this about him, and it gives you a little perspective on the mentality and philosophy that he brings to the discussion. But he worked with healthy or handicapped patients, and he collaborated with a local psychologist, and they had written a number of papers, and he did that for 4 years. So he has all of that training in his background. And then he moved into a solo private practice for the next 16 years. But he was always so involved with the teaching aspects of his profession, so he became an adjunct professor at the School of Dentistry in Chapel Hill. Then in 2002, he was back into the private practice, but he also had a lot of very high-level institutes develop some training for him and with him in the cosmetic dental field. So now let me bring you up to date and tell you that he is with us at HealthyStart. He found that this is cutting edge treatment, and that he had so many children in his own practice that he was able to deliver this for, that he decided can't stop there. He is going to share his experience and his wisdom with not only moms and dads that come through his door, but are sitting in front of the screen tonight. So he is going to be the one to share this story. And I will say that Dr. Dolfi and his beautiful wife, Karen, who we've all gotten to know and love, have been married for 37 years. He has 3 children, and they are all so engaged in life, and they live in Cary, North Carolina. So Dr. Dolfi has a great perspective, tons of experience. I love the philosophy that he brings to this discussion. So I'm ready to turn it over to him. Dr. Dolfi, go ahead. It's your turn. Go ahead, share your screen.
Well, fantastic. It's so great to hear from you, Cathy, tonight, and so wonderful to hear and be able to have the opportunity to speak with everyone that's on board with tonight's webinar. Welcome. Welcome to the Healthy Start family. Listening this evening, I would like to hope that I'm going to inspire you, I'm going to motivate you, and certainly give you a more than small peek into the open window of what we can do to help the silent crisis that's troubling our children in our country. Because it is something, it's reaching epidemic proportions, but it's sort of laying out there in the weeds, and not a lot of people are paying as much attention. You'll hear snippets of it on the news, in the literature. You'll see some things maybe on Facebook or any of the other social media aspects that we use. But I'm trying to bring it out there to you this evening. I want to get myself involved with you, the listener, to try to understand this silent crisis is something that impacts almost everyone who has a child, grandchild, nephew, niece, friend, or anything else like that. You can see at the bottom of this particular slide that this issue actually has an impact on 9 out of every 10 children. When I have a consultation in my office, when I have kids come in to evaluate, it has gotten to the point where it's rare to find a child who doesn't have some of these problems. Now let's kind of look at the list of this. We don't need to go down the entire thing, but I think we can point out certain issues that come into play here. You know, restless sleep, mouth breathing and snoring, maybe the dreaded ADHD, ADD, maybe bedwetting, aggressive behavior, allergies. And as you're reading this, maybe you're beginning to think, I know we're early in the discussion, but what I'm hoping you're looking at this going, oh my gosh, I can't believe it. 3 out of 4 of my kids have some of these problems, or both of my grandchildren have these problems. And what I sort of try to hope people will realize, these things are not normal. Children should not have these problems. But the beauty of it is, the HealthyStart system is there to help. We are the cavalry coming over the hill, okay? We want to be there to help you with your child and or grandchild and or niece and nephew, to help make an impact that's going to be so far reaching that it will change your life as well as changing the lives of your children. So the research that we've had over the past 20 years, each of these conditions that I've mentioned, let me go back, each of these things you see listed, and there are actually many more. These are just a brief listing of what we've got. But without question, these things are related to sleep disordered breathing, SDB. Maybe you've heard of it, maybe you haven't. One of the things you can do as a parent to try to get an understanding of, does my child have an issue? Is there a problem? Are they suffering in any way? What I always tell the parents in my practice, I just say, look, here's what I'd like you to do. Have your child go to bed. Now, again, we're talking about children ages 3 to 12 or 2 to 12, somewhere in that. That's kind of our wheelhouse for treatment, shall I call it. In any event, what I want you to do, have your child go to bed, put to sleep, brush their teeth, read a book, whatever you do at nighttime, your routine. Go downstairs or into the living room for a while, and then about 30 minutes later, go back into the room. Wait for them to be nice and, completely asleep. Quietly walk in and then just sit down for a moment, 3 to 4 minutes maybe. And I want you to look for 3 different things. 1, are they grinding their teeth? 2, are they snoring? 3, are they breathing through their mouth? That's the big 3 for me. And one of the reasons I like those 3 is they're all easily identifiable. If one of those 3 conditions or more is occurring with your child, they are suffering from sleep disordered breathing. And that's not a good thing. I know for the longest time, as Cathy mentioned, for me, been practicing since 1979. Actually, July 16th, just this week, was my 38th anniversary of practicing dentistry. A wonderful profession, a wonderful career. I've loved it. Wanted to be a dentist since I was a little boy. So for me, how shall we say, I'm living the dream. Anyway, it's been something that I wish I knew Healthy Start 38 years ago. My own son, my wife and I's son, he was grinding his teeth all the time. He suffered with bedwetting episodes. Boy, I wish I would have known something then, but I didn't. So I did the best I could, like everybody else. But I can remember so many times telling parents over the years, hey, you know, Megan grinds her teeth, Jimmy grinds his teeth. And I would just say, you know, that happens. Don't worry, they'll grow out of it. Oh, that was just the worst thing I could have said, but I didn't know. I just didn't know. Not only will they not grow out of it, there's a possibility they may grow into some form of sleep apnea. So these issues with sleep disordered breathing, we need to find out about what causes them, what are these conditions, what are the causes, can we help? Now, let's say in fact you've identified these problems, one of these problems, and you say, okay, I'm off to the pediatrician. I'm off to the children's psychologist. I'm off to the pediatric neurologist, whomever it may be. Here are the things that are going to come into play to try and help you, okay? Drugs, allergy testing, tutoring, special ed, counseling, therapy, maybe surgery. You can see that all of these things together, though, think about this now. Are they really treating the cause? Or in fact, are they basically just looking at the symptoms? Because in fact, most of the people that you do talk to do not have a solution. Okay? They only treat the symptoms. I kind of call it's like a little Band-Aid, and it doesn't even have any adhesive on it. It's not going to work. And it is a testimony to the fact, if any of you out there have used any of these techniques via your pediatrician, you know it's not working. There are short-term solutions. There's all kinds of side effects. Not to mention, from an investment standpoint, you never know what that's going to be. Sometimes these things are painful. And most of all, as it says right here, ineffective. They don't work. Okay? Anytime anybody out there, think about it. If you're trying to solve a problem, don't you want to try to latch on to the cause or reason behind that problem and then follow a sort of series of logical steps to solve it? But if you're not familiar with how to do that, then basically you'll pop a little Band-Aid on and, see what happens. Maybe it'll work, maybe it won't. It's unfortunate, really, really unfortunate that basically our healthcare system that we have, citing the many professionals that I just spoke of, really don't address these problems and don't deal with them at the root level, down at the cause, down at the reason. Why are these sleep disordered breathing issues happening to our children? But here's the cool thing. Dentistry can help. We have the knowledge, we have the tools, we have the expertise. I just finished last weekend teaching a course in Orlando. I'm teaching another course this weekend in Charleston. What am I doing? I'm grabbing hold of the doctors in our area and that come to these seminars, and I'm trying to give them the knowledge and training that I know and can help them help you and your children. So as dentists, we have this knowledge. We can actually impact this situation by solving some of these problems. The dental community no longer deals with just teeth. When I teach the course, I always say to my fellow clinicians, I say, today we're actually oral physicians. We've stepped out of being a dentist. The realm of treatment that we deliver is so far-reaching that I think we are oral physicians. And this particular program, the Healthy Start program, proves that even more so than others, because we're right in the middle of understanding how we can help these kids get healthy and stay healthy, how we can latch on to how that child will be in the future. I always like to say this to parents. I really, really want to help, because what I'd like to do is I'd like to create an even better version of your already wonderful child. It's all about help. That's why we do what we do, right? It's all about help. Now, when we look at these two pictures, we think to ourselves, are these healthy children? Now, I think everybody would look and at least in their heart just sort of say, wow, kids don't look too happy, do they? They look kind of sad, and you see this young guy and he's got these dark circles under his eyes like, oh boy, I haven't slept in weeks or months. And you have this young lady, she's a pretty girl, but gee, she just looks so sullen and unhappy. And she even has also a little bit of dark circles under her eyes. I don't think these kids are healthy. And I think one of the problems is we see these children, we see these kinds of portrait photos, and we day to day in our lives, we see these children and we have begun to just think that that's the normal way they should look. That's just not good, okay? These kids are not healthy. Are these two young ladies healthy? I think what we're trying to point out here, though, is that it may be not so easy to tell as these two, where you think to yourself, wow, yeah, they really look like they could use some sleep. I mean, they just look really beat. Well, these two young ladies don't necessarily have that appearance, but what they do have is what I would consider to be a lower jaw that is pushed back and has never been given the opportunity to grow normally down and forward as a lower jaw should. So what I'd like you to do, just for a second, I want you to pretend there's a little point here, a point here, and a point here. Now, when you go forehead to nose to chin, it should not be such a dramatic curve. The tip of that chin should be out here somewhere. That's a full, in the picture anyway, that's a full 5 or 6 millimeters of difference. Likewise, when you come to this pretty young lady, we go tip of the forehead, nose, and chin. I think you can all appreciate that it presents a severe curve. And that severe curve is an indication that the lower jaw has not developed properly. Now, you're saying to yourself, okay, Dr. D, what's that have to do with anything regarding sleep disordered breathing? This doesn't even make sense. It doesn't even seem applicable. Yes, you're right. The children their jaws aren't developed properly, but what's that have to do with anything? It has a lot to do with everything, because the lack of proper development of the lower jaw turns out to cause a restriction in the airway and therefore reduces the valuable amount of oxygen that should be present when children are sleeping. And I'll show you some pictures in a few minutes where I can even accentuate that further by taking these same children and picture them sleeping with their mouth open. And I'll show you what that will look like. Now, when we want to get back to, we said that we have the tools, we have the knowledge, we have the ability and the training to treat the actual cause of these problems. We say to ourselves, okay, what are these causes? What are some of the things that are going on? All right, first of all, mouth breathing. Remember I said my big three: clenching, snoring, mouth breathing. Mouth breathing allows the lower jaw and your tongue to lie backward in the mouth and push toward the back of where the windpipe is, and can cause a reduced airway. If you suck your thumb and or your fingers, what you're going to do is cause, if you're really a little person, you're going to push the palate. The roof of your mouth is actually going to be pushed up higher, causing a bit of a close off of the airway where the air comes through your nose, and it's also going to force your chin back and your tongue back. Now, these things are all adding to improper air circulation, improper breathing. You get an upper arch constriction or a high palate, which definitely has an effect on it. Now, one of the key points to sleep disordered breathing and its causes of all the issues we talked about back on slide number 1 have to do with the fact that if you're not breathing properly, you don't go through the proper sleep cycles. And when you do that, particularly evident is my next to the last bullet point of reducing REM sleep. Oh my gosh, REM sleep can't tell you how critical this is. It's critical for everybody, for all of us. Everybody listening out there, you need some REM sleep. There's no question about it, because it is the most reparative stage of sleep that you can go through. But think about it for a second. If you're an adult and your systems are kind of already developed, sure, you'd like to have a good night's sleep with all the cycles, but spin that back. Spin that back to a 5-year-old. The development of all of the systems of their body, so critical. The highest rate of and speed of development occurs during REM sleep. So doesn't that go 1 + 1 = 2? If you're not getting the REM sleep you're supposed to, guess what happens to all the developmental systems? They don't work. They don't go like they're supposed to. And look at that last one. Sometimes this causes multiple behavior, social, and body health symptoms. Something I find always interesting when the kids come to my office for a consultation, when they come in, we always have a little thing in our staff. We always try to guess how old the child is before we actually talk to them. And you know that we never get it right. We always think the child is younger than they are. Had a little girl the other day, I thought for sure she was 6, maybe 6.5. She was 9. Now, I'm not saying that does every time, that it's always applicable, but I can tell you, because these developmental systems are slowed, they're not allowed to progress as they should, you'll see things like that. Short of stature, social behavior is they appear somewhat remote, shall I say, or they're introverted. They may suffer from other issues with behavior that sort of link themselves to other traits like ADD, ADHD. I'll talk about that in a second. But you'll see other things that come into play because of this sleep disordered breathing. Now, when a child develops, we want to use this term craniofacial growth. Now, that sounds like kind of a big word. And what it really means is just your head and your face. How does your head develop and how does your face develop with it? Well, not important to trace all these lines, but what's important at age 2, if you kind of pretend you're this line, by the time you're 17, you're out here. Now, one thing I want to look at is take a look at the chin when you're 2 here, and take a look at it here. What we find that about 55% of 2-year-olds, that whole head and face thing is developed about 55% of the way. At age 4, it's developed approximately 75% of the way. At age 12, it's up near 93% for both boys and girls. So how that's a critical point is if some habit is occurring, or some, shall I say, dysfunction, something not working correctly, does not allow the lower jaw to grow down and forward, you'll see how that airway can be constricted or restricted. You must have this kind of growth to have proper development, to therefore have proper sleep, to have proper sleep cycles, to have REM, to have everything else you need to be. How come our kids are not like that? How come we see these kids that look sleepy and tired? How come we see them with the lower jaw pushed back? What are some of the factors? Well, the wonderful Dr. Robert Cuoricini, he did some studies a little while back that talked about what are we eating and what impact might that have on the development of the jaw, the placement and position of the teeth, and then how that might relate to airway. So he's kind of saying that unless we choose some stuff that's got some tough stuff to it, a little bit of consistency to it, if you don't do that, then you're going to get some irregular patterns of how your teeth come through, and you're also going to get vastly underdeveloped upper and lower jaws. This results in something we call in dentistry a malocclusion. All that means for you out there is that your teeth and your jaws don't fit together correctly. That's all it means. If you hear the word malocclusion, things aren't fitting and working correctly. And that happens when you have underdeveloped upper and lower jaw and improper tooth position. Now, in the so-called Western culture, in Europe and in the United States, these studies were done, and they kind of took a look at, is this something that passes down through generations? Is it something that we should be worried about? Should we say to ourselves, oh, okay, processed food, whatever. I think today all of us certainly, you see the evidence about how processed diet and people that are overweight and our epidemic of obesity and things that happen in our country. But I'm going to take you a step further tonight. I'm going to get you one more look into the processed food industry, the soft diet, and the huge input of sugar and things like that. what we find is we'll see in the first generation of the people who kind of use that diet as their mainstay, about 50% of those people suffer from some kind of malocclusion. All right, teeth and jaws don't fit right. We bump that to the second generation and keep those food and diet patterns. All of a sudden now we're up to 70. Oh my gosh. Now we go to the third generation and take a look at that statistic. 85% was some type of malocclusion. I can tell you right now, from my own experience, when I look at the kids in my office, it is incredibly rare to see a child who doesn't have some kind of malocclusion or some kind of problem where their teeth aren't jumbled up, the arches aren't rounded, their face is not developing properly, their lower jaw is depressed down and back, and they're not sleeping. Put that all together, sleep disordered breathing, we've got problems, okay? We've got problems. Now, I'm not saying that you hand your infant a carrot and have them start chewing on it. But I'll be doggone, if they've got a couple of teeth in there, nothing wrong with giving them something that's more firm than a melt-away. Some little processed food thing that as soon as it goes in your mouth, it disappears. It just dissolves instantly. That's not good. If you have some teeth, you can chew some things, okay? We get a little bit kind of, over paranoid about possibly choking. And, don't get me wrong now. I'm not trying to go down the road of having kids eat food, solid foods before they should. But I think we've jumped over a little bit to where we're so upset about or so concerned, anxiety ridden, that we're having children eat things that they really don't need. They need snacks that are healthy and that are firm and have some resistance so that when they chew, their jaws and teeth develop correctly. Another thing that comes into play here is the use of a pacifier. Now, I mean, we have 3 kids, I can remember the days when, they were little and the pacifier, it has its moments. You're trying to do things, the world around you is spinning and you have all 3 kids with you and 2 of them are screaming and you just say, here, put this in your mouth. I'm not going to sit here and make a big issue about that. But what I will say to you is that if you use a pacifier beyond 6 months of age, you are beginning to contribute to a malocclusion. You're beginning to contribute to improper arrangement of teeth, jaws, and everything else. Also, prolonged feeding with a bottle is also not so good for kids. You've got to be careful that you don't go beyond about 6 to 8 months because that begins to promote improper development. Now, when I see a child, what I like to see, I say to parents, I want the picket fence look. Spaces, 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 everywhere I look. Every single tooth has a space. Now, that's not something that's rocket science. Think about it for a second. Let's talk about this tooth right here, all right? That big old front tooth right there. These are baby teeth. Now, this tooth probably measures about 6 millimeters in width. The new adult tooth is going to be 1.5 times the size of that tooth. So I hope you're thinking, if in fact these teeth are perfectly straight with no spaces, well, what's going to happen? When the teeth come in, boom, crowded. Without question, they're going to be crowded. So I'd like to see spaces. Don't see it very often, but I'd like to see spaces. That would be the perfect deal. A few minutes ago, I chatted with you a little bit about the airway. It may be a good idea right now just to look at what I call a cross-sectional diagram of someone's head. And in that cross-sectional diagram, we can identify some of the things that are pertinent to our discussion tonight. First of all, you have where the teeth sit together right here. You have the big old tongue. And let me tell you, the tongue is the most important orthodontic instrument known to man. That rascal will move teeth and separate jaws and do all kinds of stuff if you don't train it properly to do what it's supposed to do. Okay, here's the nose. You breathe through your nose, and your air goes through these things called turbinates, and then it fires on down the airway, okay? Epiglottis, it closes off the airway when you swallow so that food doesn't go down the airway. But you see a relatively wide airspace here for air to move correctly through there. And that's what we'd like to see. Sometimes we look at the development of the upper jaw as well. And our studies are showing us that, in fact, if you have proper expansion or proper width of both the upper and lower jaw, that will help correct sleep disordered breathing issues. That we do find that many times children and adults, for that matter, when I see adults whose arches are so crowded, and what do I mean by that? The distance from here to here, the distance from here to here. This skeleton, or this picture that we're looking at, has very rounded, well-proportioned upper and lower jaw. Many times when I look at kids and adults, they often have V-shaped arches. Just think of them being constricted, almost like you put your thumb in your mouth and you sucked as hard as you could and it pulled all your teeth together. Okay? Sleep disordered breathing is directly related to that jaw constriction. And if we can deliver some type of treatment that will help that, it'll be major league improvement. Okay, I talked to you and I told you I'd have some pictures for you. All right, here's an airway in a normal developing child. Look at the distance between here to here. Okay? We have the tip of the forehead, nose, chin. Okay? As this child develops, we want this chin to come down and forward. Think about that for a second. As this lower component grows forward, what do you think might happen back here? I hope you're thinking, yes, this airway will actually even get a little bigger. How cool is that? Now, let's in fact take a situation where the lower jaw has been pushed back or not developed properly. And now look at the airway on this one. Oh my heavens. Wouldn't you say this is like a garden hose? That's like a coffee straw. Sometimes when I have the kids come in, I'll actually have mom or dad, who's ever with, say, here, take this coffee straw, suck in as much air as you possibly can. Well, you can't. You put it in your mouth and it's like, you just can't breathe. And I think, imagine that's a big giant straw that's an inch and a half in diameter. Boy, the air is going to flow through there like you wouldn't believe. So if we go back again, here we have lower jaw, good positioning, nice airway, lower jaw retruded back, airway constricted. Now in our photograph, nice. There we go. Tip of the nose here, tip of the chin here, not back here. So what do we have is a normal jaw developed down and forward. Here we have a lower jaw, never had the opportunity to develop properly, whether that was from a habit of some sort or processed food, eating, the diet, the different things like that. This lower jaw, in fact, is not forward, it's tucked back. So with that being tucked back, what do you think is going on with the airway? You got it, it's restricted. Now, remember I mentioned my big three. When you go in to notice your child or grandchild sleeping: grinding teeth, snoring, mouth breathing. None of these things are acceptable, folks. None of them, okay? If you see them, I need you to get in touch with your one of your dentists in the area that's a provider. And you can go on the HealthyStart.com and punch in your zip code and you'll find a provider in your area. In any event, this little girl sleeping in the car, tilted back, mouth wide open. If we had her head tilted to profile version, we could see that her lower jaw is quite retruded. And if it is, that's going to cause a restriction in her airway. I can illustrate that even better with this little video.
Listen to this mother describe her baby's sleep disorder breathing. There you go. Now watch what happens when she's able to open the airway by simply shifting the position of his jaw. Now watch what happens when I take his jaw and I just bring it forward. If I can. Let's see if I can. Airway. Just bring his airway forward. Listen to the quiet breathing. Now he's breathing through his nose.
That's perfect evidence of what I was trying to illustrate regarding why mouth breathing is such a negative situation, and it is a root cause of sleep disordered breathing. You notice how quickly, when his lower jaw was pulled forward, it opened the airway. Suddenly his noisy, snoring, kind of irregular breathing pattern immediately was dissipated and there was quiet all around. Okay? So that you need to really keep that in focus and in your memory. Here we go with the coffee straw. We don't want kids breathing through that. We want them breathing through a big old garden hose. So let's try to put the whole thing together. Sort of created kind of a little flow chart for you here. Hopefully this will help explain the prior discussion and the lead up to this point. So what we have up here is we have maybe some extended bottle feeding and pacifier use. You have a soft diet processed food, sucking the thumbs, fingers, pencils, whatever the case may be. All these things together contribute to underdeveloped arches and jaws remaining. The arch itself, when I say underdeveloped or improperly developed, instead of being a beautiful, round, open curve, it's almost V-shaped. So now you take this particular development that's occurred in the child and you swing it forward, because now we know this is going to compromise their airway. What does it mean by compromise? It means it restricts it. It takes it from a garden hose to a coffee straw. Well, when that occurs, then you have the following things happen. Mouth breathing, snoring. If you don't breathe through your nose, you often, when breathing through your mouth, will cause swollen adenoids and tonsils. Think about that for a second. If the tonsils puff up and you're trying to breathe through your mouth because you're not breathing through your nose, the puffed up tonsils close the airway even further. So that even causes more trouble. You have the improper position of your tongue. Arches are not right. You have a malocclusion. Remember that word I used earlier, malocclusion. Then you, in turn, will often find that you'll have an overjet or an open bite. Now, okay, what does that mean? What does that mean? All right, an overjet would mean that the upper teeth are sticking out over the bottom teeth a considerable distance. Overjet, okay? Open bite means that when the child closes their mouth together, their front teeth never contact. That open bite can be anywhere from 1/8 of an inch to 2 inches. Can be very severe. Then you couple that with having maybe something called a crossbite, where their teeth, instead of overlapping properly, they're crossed over. They're not hitting correctly. Now, so you took this problem up here, the cause of the issues, then causes a compromised airway, then leads to sleep disordered breathing. What does SDB lead to? I showed you right at the top of the show tonight. All these symptoms come into play. All these symptoms come into play. Here's the beauty of it. Healthy Start. We can fix it. I help these kids every day in my office, and I see results every day. Results that would bring you to tears, honestly. Mom's calling me, telling me that their child no longer wets the bed. Mom's telling me that their children do better in school. Telling me that they wake up in the morning, the kids are raring to go. Just time and time and time again. We in the dental profession can fix it. Here's how. We use Healthy Start. Now, this particular system, Cathy mentioned to you right at this top that Dr. Bergersen, has invented all these amazing appliances. It's like different styles and types of oral mouth guards that will help these symptoms, treat the root cause of these problems, alleviating all the symptoms that I've talked of. You can see that it's been going on all over the world. Now, here's the things it can do. By wearing this particular mouth guard, you will expand the arch. You will be able to help the person establish nasal breathing. That is so absolutely critical for proper development. Your nose and the filtration system that's associated with it takes all the crummy stuff that's in the air, you breathe in, and miraculously, it becomes perfectly pure and clear and healthy. But if you don't breathe through your nose, then all that air junk goes flying down the windpipe and gets in there and starts causing trouble. So you're going to have nasal breathing is the key. These appliances promote that. We will train the tongue to stay in the correct position so that when you swallow and you speak correctly and you swallow properly. It will eliminate all these habits. I can eliminate thumb sucking in usually a week. But what I do with that, see, is I don't tell the child or the parent that I'm going to eliminate thumb sucking or I'm going to eliminate the habit. I say to them, I'm going to replace that habit with another habit. And that will be to place the Healthy Start mouth guard in and use that to replace the thumb. But the cool thing is there's a method to my madness, okay? Because once you get the thumb out of there, then all of a sudden the Healthy Start mouth guard starts to promote proper position of tongue, lips, teeth, arches, growth, mandible, blah, blah, blah. All stuff ends up working out perfectly. Okay, when the Healthy Start program's in place, we can get that lower jaw to come down and forward, which will correct that issue I talked about with Overjet. It opens the airway, also encourages proper growth, and you get an ideal overbite and Overjet. All the teeth fit together, and it also ends up causing almost no relapse back into the positions of where the teeth were before. 97% chance of perfect dentition by the time the kids are 12 or 13. Many of these cases do not need orthodontics later. Let's just show you a few pictures of some kids, and we'll just kind of buzz through these nice and easy. Here's a little guy, 9 years of age. I think all of you can identify. Let's do it. Forehead, nose, chin. Where's that chin? Wait a minute. Come on now. It should be out here, right? Not back there. Sometimes when the kids have a retruded chin like that, retruded lower jaw, they almost look kind of chubby. But this little guy's not chubby. It's just that his chin's pushed back. If he could breathe properly, his lower jaw would develop down and forward, much like it has here over the years of cooperating, or should I say being treated with HealthyStart. Here's the picture, the x-ray picture. Let's go back one. Now we look at Michael here. Then we go one more forward. Here he is before. And we notice that the airway is kind of pushed back. You'll see that his lower jaw is back here. Look how nice it's opening up. We see a nice big garden hose there, and everything's coming in there, and he's breathing better. And we know if he's breathing better, he's what? Sleeping better. That helps for development. The cool thing here, when we go through this program, all of our children that we treat, by the time they get to be 12 or 13, they kind of look like Michael over here. They don't need braces. That's pretty cool. Now, it's never a guarantee. I never say to my parents, absolutely guarantee this child won't need braces later in life. All I can do is quote Dr. Bergersen's statistics. Tons and tons of research showing that 93% of the kids don't need braces later in life. Here's another healthier Michael. He was a great young guy here, but this is just an even better version of him. Okay? Good guy, looks great, feels good. Here's a scenario here where the sleep disorder breathing issues were addressed, but we also ended up with this child having issues with their position of their teeth. So we had them go through the system wearing the guards as directed, and here we go here, 12 months of treatment. Look how nice and round. Let's look closely at the width of the arch. Notice if you go from here to here and step across and go from here to here. Holy smokes, that's like a 3 to 4 millimeter increase in width. This one back here, his tongue couldn't even fit in the space. Now it just sits in there nicely, works out beautifully for you. I mentioned earlier that there's sometimes a connection with ADD and ADHD that can possibly be attributed to sleep disordered breathing. And Dr. Karen Bonnick has been responsible for doing a ton of research on this. And her program and her research program enlisted 11,000 children, studied over 6 years, okay? And what are her results? We know that sleep disordered breathing increases the risk to these problems by at least 50%. Her study was published in 2012. Today, we're now using figures closer to 60%. I would tell you, as a parent and a clinician, if your child is currently being treated with ADD or ADHD, it is at least worth looking at the issue of sleep. Is this child sleeping properly? If you need help, go to your HealthyStart provider. They can do the job for you. Because if you go to the pediatrician, they're going to wave their hand in your face and say, no, it's not a sleep problem. And that's really just the fault of the profession at large that isn't trained and doesn't want to listen to all this research that we have. Okay? I don't need to get on a soapbox about that. It's just important for me. My goal is to help as many kids as I possibly can in any way that I can. So therefore, if I can help any of those children taking medications and things like that, that maybe they don't need them, I would be thrilled if I could. Now, here's a huge issue. This is something that is just amazing. You almost couldn't believe it. It almost seems counterintuitive. How could bedwetting be associated with not breathing correctly when you sleep? Well, you see, I talked about the REM sleep and how it has such a huge impact on things. It causes the development of the systems to all what I call marry together. The endocrine system, the hormone system, all these names for all these different things. But think about, a gajillion different things in your body that are trying to develop and grow and kind of just marry all together into a beautiful person. All these different systems, you must have that REM sleep. If you don't, they won't all pull together and do the right thing. Okay, for us, we wake up in the morning, our feet hit the floor. What's the first thing we do? We go to the bathroom. Our body just goes red alert, you need to get to the bathroom. Boom, there we go. For the kids, if they're not doing the REM sleep thing properly, all those systems don't work properly. They oftentimes go into a deep cycle of sleep called delta, and they don't know that their bladders are going to empty. But you'd be absolutely amazed at how much success we have treating children who have bedwetting issues. Just the other day, I got an unbelievable phone call from a mom who their son is 10 years old. I put him into the HealthyStart program with the first phase of the mouth guard to wear, and 2.5 weeks later, she called me, and I thought she was just going to come through the phone and hug me. For the first time in the child's life, he woke up dry. He was so excited. He just looked at mom and he just said, "Does this mean that it'll work forever?" No, it was just, man, it just about brought me to tears, you know? Anyway, bedwetting is a huge problem, and it can be solved with HealthyStart. Here's some other case studies to kind of go through for you, just to show you some things. Here we have a 5-year-old with what do we think about that lower jaw? Not in the right place, right? Treated properly with HealthyStart, lower jaw down and forward. Now we see a very nice profile. And here we see it age 5, or 5 years later rather, and then post-retention at age 12. Look how pretty her teeth look. That's a gorgeous case right there. Here's another guy who's 12, between he's 12 and 14. Now, I don't think his issue is so much of lower jaw growth, but he was a mouth breather, and he also snored. And so we just needed to get in there and correct the position of his tongue and try to get his arches widened out a little bit. Now, I will say this to you, and this is really important too. The HealthyStart program centers itself around the issue of growth and development. You take growth and development, couple it with the HealthyStart appliances, and it is a slam dunk, home run, kick the field goal, you win the game kind of a deal. All right? Now, the later you catch these kids in life, the system still works, but it may require more time and more commitment on the part of the child. You like to be able to capture these issues when the kids are little, because then as they're growing and developing, you can just walk along with the HealthyStart appliances and get the perfect results. But either way, by widening the jaws and getting the teeth set better, we did a really nice job here for this patient, and everything came out really well. Here's your young guy, 8-year-old, you know, kind of having a funny look at the camera. And I will say this, in this 6 years of time, he certainly changed his hairstyle, didn't he? He went from here to here. But we look at his teeth, very typical scenario where he has a wide gap between his teeth. They're flared out. His jaws are constricted. And now look at the space that he has, and his teeth have come into position properly. It's a really, really great system. It's a system that will help so many children. It's just unbelievable. What I'd like to do now is just show you a little bit of an example of one of my fellow clinicians who talked to you a little bit about how HealthyStart impacts her patients in her life.
It unlocks their potential. I mean, if your kid is suffering, they can't breathe, and it is going to, if they can't get oxygen to their brain, I know that parents want to do whatever they can to help their kid be the best, grow the best they can. And in this society, we do so many things geared towards that, and sometimes we think it's the best, and it may be from drug perspective, or like we're doing it because we think it's the best for your child. But and HealthyStart gives us a natural way to do this for our child, and not plug them with chemicals, and just deal with their own like way of growing, and just helping them grow, which, you know what, can make them smarter, make them not act out as much, and can make, them prettier. If you have everything in the right place, you are a better looking boy or girl. So, which builds confidence, and there's just so much to go with that that can set you up for success 20, 30, 40, 50 years down the road. And if a parent can do that from a piece of plastic, awesome.
I think that Dr. Stam points out something that came into play for me this past weekend when I was teaching in Orlando. After the course, I went down to the restaurant and sat down and had a sandwich, and a fellow sat down beside me, and conversation started, and It turned out his son, 8 years of age, wet the bed, grind his teeth, snores all night, doesn't do well in school, isn't a very good athlete, all these things together. And I sat there and just chatted with him for a long time. And he finally looked at me and he said, you know, it's my obligation as a parent to try to help my son be better about what he does in life and be more successful. So I'm going to get this program underway as soon as I get home. So Cathy, those are some of the things I think that you can relate to with the Healthy Start program and all the successes. Would you have any other things you could point out for us this evening?
Well, first I want to say, as it relates to the man that you sat next to at the counter and shared your lunch hour or whatever, it's what is happening on our watch. And there's a lot of stuff that we just can't know about, but once you know this, you can't unknow this. So this is on your watch. And now that you understand how all these dots connect and that there is a solution, it's just like that man said, you've got to see to it. And that's what happened with my grandchildren. And it's just such a life-changing thing. I will share this real quickly. My grandson, who just turned 13, so we caught this kind of late, but, you know, dad's 5'4", mom's 5'3", and, you know, here he is, the little guy who has not publicly, openly smiled in years because he's got the crossbite and the canines are this, and, you know, it's all going on. And he talked kind of confidentially about if he could smile. Well, now things are lining up beautifully, and I couldn't be happier because we didn't have to go through the last 2 years of being in this emotionally stressful, painful situation. This is like the perfect bridge between you know, the dental care and the orthodontic care, so that this has always been what's necessary so that these children who are in this gap, as you were describing, just have so much better an experience. And it kind of brings one thing to mind that you've watched this for years. But I don't know that we talked about this or that we think about it very often, but man, it's a setback. If you have a child that is dealing with a removable appliance versus something that is bonded to the teeth, talk about the hygiene and talk about the consequences of having this apparatus for a couple of years, and then what happens when they come off. What evidence do they see of the hygiene that's taken place, or just the average, you know, experience of what it's like to have that complication, Dr. Dolfi?
Well, I think that, you know, the comparison there, when you're trying to look at, can we correct a problem with a non-invasive, safe, small mouth guard of sorts, okay, to place it in someone's mouth and gain these corrections. So not only do we introduce that to help in the first phase with their breathing issues, once we get that right, then we go in and use a series of appliances to essentially guide their teeth into the correct positions. I just say to kids, we're just going to bring them home. We're going to put them in the spots they're supposed to be. Well, if you compare that to waiting until you're 13 or 14, and then all of a sudden you've got brackets, wires, and all sorts of gizmos in your mouth that aren't very comfortable, number one, very difficult to clean around, and basically hard to eat, and it just sort of manages, that thing manipulates your life as compared to the Healthy Start appliances, which kind of just work with you as you grow. And it's just an amazing difference between those two impacts, or those two devices, I should say, or modes of treatment. You're just so successful with Healthy Start, and it's so much kinder to the children. And you get the big plus of also helping them sleep better, breathe better, and be a better version of themselves. So it's just a slam dunk.
Well, you know, slam dunk, it all sounds great because you've got, you know, on one hand, the possibility of kind of late in the game after the fact and not such a great option. And it's only because you missed and you didn't understand this was possible. And you've got the cost and consequences of going that route. But with everything that Healthy Start can do, I think the parent is sitting back going, oh my gosh, this is what they need. What is this going to cost? What is this going to cost? So can you talk a little bit, because you're dealing in your office, of course,
sure,
going through that consultation to explain it all.
Absolutely. So when I talk to parents about it, you know, and I'm a realistic person. I tend to kind of do things a little more conservative by nature because my theory has always been do the simplest thing first. If it works, woohoo. If it doesn't work, then we'll try something more complicated. So in regard to that, then I look at this and I say to myself, all right, we're gonna get involved in treatment sometimes at the age of 3 or 4. And then we're going to track this child all the way until they're 12 or 13 years of age. Well, let's even back up and take an example of an 8-year-old. We're still going to treat this patient for about 4 to 4.5 years of time with various different appliances and different modes of treatment that we use. So when I say to the parent, okay, the fee for the entire service is $4,500, remember that there's an incredible amount of treatment that goes into play. There's an incredible amount of research and development that's gone into play to develop these appliances that work so well. And over a period of 5, 6, 7, sometimes 8 years, that fee covers all of it. Now, when you look at traditional orthodontics, sometimes you can look at paying anywhere from $6,000 to $7,000 for the treatment, and it's going to last 2 to 3.5 years. That's fine. That's all good. I would never, my orthodontic colleagues are wonderful. They do a beautiful job, and it's certainly worth it. But I always consider that we've not only solved sleep disorder breathing issues for your child, but we've also helped them straighten their teeth over that period of time. To me, that's a bargain. Now, what we try to do is we look at it and we say, okay, but not everybody can just say, okay, here it is. I'm ready to start. Here's the money. So you have to be a little bit creative. You try to help people. That's what we're in it for. Say, okay, what makes sense to you? Can you take this fee and maybe bump it out over 12 months? If you have some dental insurance, once you start the orthodontic part of the treatment, your dental insurance, if you have orthodontic coverage, it will bump in and it will help that too. So there are many ways to be creative about getting this to the final result so that we can help these kids and get them in a good spot.
I think about one of our doctors, because you're in North Carolina, I'm in Texas, and one of our Dallas doctors, who actually is 4th generation, and she wore the appliance as a child.
Yes.
So she's just phenomenal with her practice and the children that she takes care of. But in her zip code, a standard braces scenario is $9,800. So we're looking at about $10,000.
Yes.
And now you talk about what that is for the period of time, maybe 3 years that they're in treatment. But there's one more thing to consider, and that is what happens after the braces come off and for the next 40 or 50 years. I mean, I keep hearing stories about relapse and all of the ongoing expenses that are tied to the fact that you didn't really solve the problem. You have a temporary improvement in the problem.
Yeah, I actually do adult orthodontics in my office, and I can tell you that I battle consistently, or constantly is a better word, for trying to retain these cases. I've moved the teeth where they're supposed to be, and they look like $1 million. But man, it's hard to keep them where they're supposed to be. I could probably go for 30 minutes about talking regarding how those teeth are in position and why they're so difficult to keep there. But the point is that that it is critical to place retention of some sort in play to make sure these teeth don't move back. The beauty of HealthyStart is if you catch the children in that phase where you can help guide their teeth home, get them in the right locations where they're supposed to be, then the ligaments that hold the teeth in the bone attach and permanently hold the tooth in position. So you don't really have to worry at that point about whether there's going to be a relapse. It's just an incredible system from start to finish. Incredible system.
I have a friend who has 3 or 4 kids, and I love it because I've been talking about this for a long time, and they homeschool their children, and they're so on top of everything. And he heard me talking to a doctor the other day, and it registered. And he said, now I get the fact that the clock is ticking, and I liken it to a child with scoliosis. If the child is growing and their growth and development has a curve in the spine, no doctor would say, hey, let's just let you go all the way through. Let's see how bad it gets, and then come on back and we'll talk about it.
Yeah, the classic phrase is, you'll grow out of it.
Mm-hmm, right.
Not going to happen,
Like the sapling bends, the tree.
Yep.
Bends. So that's the issue.
That's right.
Okay.
That's why we want to grab onto it early and try to take advantage of all of our skills and training to help. And that's what we want to do.
Well, you had one person chime in with something that you must have said that as close as I can to the quote, the tongue is the most powerful orthodontic tool known to man. So can you explain to the parent where the tongue should be, what it should be doing, and how?
Sure. Proper tongue position is so critical to speech patterns, to development of the width of the jaws, to the positions of the teeth, as well as the ability to speak and swallow properly. So you can see there's 5 things right there if your tongue's not in the right spot. So what it has to do, it has to rest in the floor of your mouth properly. It can't be pushed forward. It can't be too far back. The HealthyStart device, or the mouth guard, will train the tongue to sit in the exact a perfect spot. When you swallow, for instance, the point of the tongue pushes in behind your top teeth to create a seal. It's not supposed to drive up into your palate. It's also not supposed to go too far back. Many times you can have children swallow something, a little sip of water, and you'll see if their tongue isn't working right, they'll make a face when they swallow because they can't seem to seal. So the position of the tongue is so critical. If left alone to do what it wants, it'll push teeth left, right, cause spaces, cause the jaws to constrict, fall toward the back. All sorts of bad things happen. So real important to train and keep that in the correct position.
All of those things, they have to come together, and if they get off track, man, you got to get it fixed before they hit the adolescent years.
That's exactly right.
Like you've described, it's basically a permanent condition then, and Band-Aids only. So what we have on the screen right now is the sleep questionnaire that Dr. Dolfi talked about. You can download that on our website, and it's really helpful, as he described, to go in there and spend time, really fill this out carefully based on information and not what you think, because you don't know until you really watch. But that's such a great way of monitoring the advances that are being made with the Healthy Start. You can call and get information, 844-KID-HEALTHY, and the website is thehealthystart.com. You can see sometimes we have events coming in your area where we have an open day where the children can come in and be given an evaluation. We've got one coming up, Dr. Dolfi, you're doing in Charleston.
Yes.
A couple of days. So, but the big message is really, so bottom line, don't wait. Do not wait. The earlier you address this, every day that you don't is a night without good sleep, and it affects everything head to toe, including their future. So with that, I say, Dr. Dolfi, as always, you do an impeccable job. It's a joy to work with you, to listen to you, and I know that you touch so many lives, not just in your practice, but now nationally and internationally by being able to do this for Healthy Start. You're a great addition to our team.
Well, thank you so much, Cathy. The feeling is mutual. You also are such an amazing person to work with, talented, brilliant, and you're such a wonderful speaker. You get your message over to the people so nicely. It's just an absolute pleasure to work with you. A final comment I will make to the people out there is, if in fact you think any of these issues are in play, if you fill out this questionnaire and any of these things are checked, find a dentist who can help you. If you go to your dentist and they don't know anything about Healthy Start, you take a piece of paper and write down thehealthystart.com and you tell them, go take a class. Okay? I want you to get some help as much as possible. Thank you to everyone tonight. I'm really grateful that you came out to visit with us. And thank you, Cathy, for helping me this evening.
Thank you very much. You can take that class even online, so don't worry. You don't have to wait for it to come to your town, because you can just right here have a match in front of your computer. So thank you for mentioning that, Dr. Dolfi, and thank you to Susie Lafredo, who is operating technically for us behind the scenes. I'm Cathy Turner for Healthy Start, saying to all the parents out there, we wish you the best and we hope to hear from you. Thank you and good night now.
Good night.